Hello guys, and welcome back to my channel. Today we are going to do a nurse video for IV insertion, and please, this is just for nursing only. This is not for everyday recreational use. This is only for medical professionals. Okay, so this is a 20 gauge IV, and I'll tell you right here what the size is. Usually most universal IVs, 20 is pink, a 22 gauge is blue. For this video I only have two sizes. They do come in 18, which is usually green. That is the largest for IV. Then we have a 20 is the second largest, 22 is the third, and then yellow is a 24 gauge, which is the smallest. So I'm just going to do an overview of how the IV catheter works and how you have to maneuver it before you insert it. So I'll do that first. So once you have the catheter open, as you can see here, this is the place we will be holding. This is the cap. So very carefully you're going to remove the cap. Okay. So here is the needle. The needle is inside of the catheter. That's how the IVs work. There's like a plastic material that goes inside the patient. The needle, it's like a pasta. Imagine a pasta, a hollow pasta. The catheter is the pasta that we see that's going to go into the patient, but in the middle of the pasta is the needle that is going to help puncture the skin. And then once we're in the skin, the needle is going to retract and just the catheter is going to remain in the patient. So for these particular IVs, this is the safety button. Each IV is different, and for this one, this is how we will see that the needle retracts. So now the needle is in here. This is just the catheter that will be left in the patient. You would then secure it like that. So I just wanted to go over a brief overview of the parts of the catheter before we go ahead and talk about insertion. Angle of insertion. You don't want to go straight up and down. You don't want to go too flat because you want to go into the vein. When you see blood return, we just saw blood return, we'll pretend we're going to drop our IV down, and then we're just going to push forward just with the catheter. It's kind of hard. Like I said, I'll show you on Dan, but I just want to show you the motions first. We're just sliding the catheter in, and then we're going to press the safety, and this would be left on the patient. Ideally, we would want that to go in more, but it's getting resistance because this is not normal skin. So as you can see, it's a little bit bendy, but this would be left on the patient. With these particular IVs, they do not have any blood flow back until you connect it to a extension tubing, which then you would flush and make sure everything is patent, and then it would go flat, and the Tegaderm dressing would go right here just to cover everything and keep it in place. We're being resourceful at home. I didn't have any tourniquet supplies or anything. They're all at work, and I'm not going to take supplies from them. I only have these extra IVs because we actually just switched and they gave us some to get familiar with. So you would tie a tourniquet. Obviously it's not this big, but you want to make sure it is a quick release. So this is like extra big, but you would cross it, tighten it up, stick it through the bottom, and have a little loop up top, and then you can quick pull release. All right, honey. Dan's being a trooper. And I'm just gonna have you tuck your hands under like that, and keep your hand like that if you can. Okay, hover over here, honey. So as you can see, this is a good vein. It's nice and straight. You can see the blood flow. Come back, you rub down. Alcohol sometimes helps veins so you can really see it. This is the valve here, so we want to try to avoid that if we can. So we'll probably do this guy. You can see where it comes up and follow it out. You don't want to get a vein that's going to nowhere. say you take the cap off. These particular IVs, you have to do a 360 turn, which they say you have to, but I don't know how true that is, but I do it because that's what we were taught. All right, hon. It's gonna be a little pinch. You're gonna insert at an angle. Blood return, you're gonna advance a little bit. Just advance the catheter. And safety. As you can see, it's good veins, got some blood out. And that's it. You would normally take the tourniquet off, obviously. And you would connect your extension tube and all that jazz, but we're making a mess over here, so we don't have all the other supplies. I'm gonna take it out, hon, okay?
Okay.
Normally you would have gauze. This is not the proper setting, and you would be wearing gloves and all that, but I know Daniel doesn't have anything. So you would always want to wear gloves. And I got my gauze and everything here. Daniel's alive. So we would pretend the catheter was there. I took it out just because it was bleeding, and like I said, I don't have the extension tubing, but the catheter would be hanging out like this, like I showed you on the potato. You would then connect the extension tubing, flush it, make sure it doesn't bubble up, and then secure your IV with the Tegaderm wrap and some extra tape to make sure it doesn't come out. And that's all, folks.